I have a question for you. Have you ever used the expression out of joint or out of line when you're talking about a person's pain or their structural problems? There's an issue with using these expressions, and it's in the fact that these terms mean one thing to the person saying them, one thing to the educated practitioner, and they can mean a very different thing to the person hearing it, the patient or the client. And we have to be careful of that because the reality is what often happens is that these can misguide the patient into understanding what's wrong with them. And they also can reduce the complexity, the true complexity of the problem. Let's start with our understanding of out of joint, in that it misrepresents what's actually going on. So we'll start with the hip. The hip being on, either side of the pelvis here. You've got two of them. And to do a close-up here, it is a synovial joint, a ball and socket style synovial joint. So that means it is rounded and it has fluid surrounding it, buffering the one side from the other. And to maintain that fluid, we need some kind of a capsule around it, which is made up often of ligaments that go around it. And it will fully encase this, it will fully surround it. I'm going to remove some of those just for clarity's sake. To imply that something is actually going out of joint is a bit of a problem, because if it truly went out of the joint, this would be considered a catastrophic failure of the joint. In fact, we would have to rupture all of the tissues that are involved in holding it in. So whether that's the ligaments or the capsule or whatever it happens to be, even some of the muscles and tendons that bridge this joint, this would not be the case for a manual therapist to see. This would be a surgical case. So saying something goes out of joint, even though we know what we're talking about, misrepresents the problem. We could talk about subluxations too. Those are a thing. Those are partial going out of the joint. But the issue with that is it also doesn't explain how it got there. So let's talk about going out of line, which is slightly better, but imperfect. So we could say that when something goes out of line, we are talking about a bigger set of structures. But let's start with just a simple vertebra. So this, we're looking at vertebra 1 and vertebra 2, and they look a bit different than this in real life. But the reality is this simplified look is easy enough in that they will have a connection point we call a facet joint, much like the hip, and then we will have surrounding ligaments really all the way around, all the way through it, to reinforce these tissues in all kinds of various directions. Again, I'm going to reduce some of that complexity just for viewing's sake. And so if it were to go very far out of place, and these things only move actually a few millimeters, again, we'd have a catastrophic failure. We would be slicing through many of these tissues, obliterating them, and we would not have a manual therapy case. We again would have a surgical case. More realistically, it would be the vertebra itself that fractures entirely. The bones would break before we'd see these things come apart completely. What is realistically happening is actually that the vertebra within multiple curvatures is moving to points of stress and strain. So I'm just going to exaggerate what's going on here just slightly. Understand that the vertebrae are within this. They make up many different points along the spine. And so when something is going out of line, it's not just a single thing, but we can have a single point within that structure going too far out. So if something is being put in a position of strain where the tissue surrounding it, these ligaments again, they run all the way up and down, they run over the vertebrae, front and back, all over. If it is being separated significantly, it will begin to strain and cause a fair amount of pain. However, to say that one singular structure is out does not make a lot of sense, because this is the product of a larger curve here. It's a product of a wider, more diverse curve. And it's being pushed into that position, in fact. It's being pushed out of place, and it's creating strain at the tissues. But it's being pushed by gravity, the weight of the spine above it, and it's also being pushed by the pressure of, let's say, the pelvis and the leg and the weight-bearing structures of the body below it into that position. So the more those push, the more this goes out of place. So to say that this one point of pain or structural dysfunction is just out of line is a very limited understanding of what's actually going on. And it in fact does a disservice to the quality work that manual therapists do to understand how the body works as a whole and render an effective treatment, to render a lasting treatment that corrects the problem.